a complicated version of the simple cold worker pneumoconiosis. This is a very disabling disease. Okay, why I'm saying this disabling disease? Because the patient cannot perform its daily routine works. The patient is mostly bedridden. Okay, he cannot perform his works. He has to restrict himself to the bed because of the excessive dyspnea and cough and everything. And it can cause pulmonary hypertension as well as cor pulmonale, which is the right-sided heart failure as well. Okay. Okay. Now we come to silicosis, and remember that silicosis is very much related to inhalation of free crystalline dust or silica dust, and it is found in the foundry workers where there is metal molding being done, sand blasting when the sand is being forced to clean the glass or tiles, then hard rock mining and stone cutting like the marble cutting and polishing areas. So these are the environmental conditions in which the patient is going to develop silicosis. Okay. Now it comes in two forms. One is the crystalline form. The second is the amorphous form. The crystalline form is comparatively more pathogenic as compared to the amorphous form, and the amorphous form comes in the powder form. However, the crystalline form comes in these type of crystals. Okay, it can combined with the coal, and it forms the quartz. It can come in the form of crystobelite or trimedite as well. And remember that the crystalline form, which is more toxic or more pathogenic, is basically the silicon dioxide, which we call as the silica. And one of the most common occupational lung diseases is due to the silicosis. Okay, it is estimated about 1 million workers are exposed to the high levels of silica. Remember that the pathogenesis of these inhalational diseases, macrophage has a central role. Okay, so whenever the crystalline silica is inhaled, what is going to happen? They interact with the epithelial cells and macrophages. They produce inflammasomes. Then inflammasomes release mediators, especially the interleukin 1 and interleukin 18, and ultimately this leads to fibrosis. So this is the mechanism of silicosis. The classification of the silicosis is basically dependent on the three things. That is the time duration of exposure, then development of time of the development of symptoms, and the amount of silica being to which the patient has been exposed. So for this, we have a chronic silicosis or classic silicosis, which is about 10 to 30 years after exposure, which is the most common one. Then an accelerated silicosis, in which within 10 years of exposure, the patient can develop symptoms. And last is the acute silicosis, in which within weeks or months after the initial exposure of silicosis of silica or fine dust, the patient can develop the acute silicosis. So this is the classification of silicosis. If you look at the gross and microscopic features of this silicosis, you see over here, these are some nodules being formed. These are what we call as the silicotic nodules. And these silicotic nodules, as I already told you, silicosis is very fibrogenic. It causes the contraction of the area, contraction or shrinking, and that is because of the fibrosis. The second thing that you can appreciate is the lining of the pleura is becoming very much thick over here. Pleural thickening. So these two things you can appreciate in a case of lung silicosis, that in the lung parenchyma, it is going to cause silicotic nodules, and on the pleural surface, it will cause pleural thickening. Okay. Now we come to the silicotic nodule microscopy. If you look over here, let me magnify this area. If you see over here, this is a silicotic nodule, okay, and you can see some whirling fibrosis being whirling fibrosis in this area, and this whole of this is what we call as the silicotic nodule. One important thing that you can appreciate is the black pigment being present over here at the periphery of this silicotic nodule. However, this what is this? This is basically the carbon particles or the carbon deposition. Okay. However, this is in the periphery. It can be present in the center as well. These carbon particles can be present in the center of the silicotic nodules as well. Now remember that the silica is a weakly birefringent material. So when you do a polarized microscopy, as you have looking at this is what we call as the polarized microscopy. So when you do a polarized microscopy, what is going to happen? The background is going to become dark, and these silicotic nodule particles are going to become brighten up under the effect of polarized microscopy. So this is the microscopy of the silicosis. Now, clinically, the upper lobe of the lungs are involved, and you can see the hilar nodes are very much calcified over here, and this is what we call as the eggshell appearance or eggshell calcification of the hilar nodes. And you can see over here these are the hilar nodes which are showing you eggshell calcification. Okay, pulmonary functions are initially normal, but with the passage of time, patient can develop progressive massive fibrosis, and then the pulmonary functions are going to drop as the disease is going to progress. As with the other pneumoconiosis, the disease can continue to worsen even if the patient has no longer exposure to the silica. Okay. Now, this is an important slide that I was telling you about the complications of silicosis. In the Kohlberger pneumoconiosis, I told you that there is no increased incidence to the tuberculosis, no increased incidence to the lung cancer. But in case of silicosis, it is very much increased susceptibility to tuberculosis as well as lung cancer. And it is said that the silica has some important interaction with the killing effect of the mycobacteria. How it happens? For example, this is a macrophage, okay, and outside the macrophage, this is the silica particles, okay. This is the silica particles, and let me use another color. And this is the, for example, this is the mycobacteria causing tuberculosis. Okay, so when they come inside, okay, what is going to happen? This is the mycobacteria, and this is the silica nodules, okay, and they are engulfed together in a structure that is called phagosome. So ultimate killing of these bacteria will need to have help from another structure, that is what we call as the lysosome. So what is going to happen? Ultimately, there should be a fusion over here. There should be a fusion between them. But this silica that is present over here inside does not allow the lysosomes to fuse over here. And because they cannot fuse, they cannot do any kind of killing. So ultimately, because there is no killing of the mycobacteria, so ultimately there is increased risk of tuberculosis in these patients. Okay. And secondly, they have increased risk of development of lung cancer as well in case of silicosis. Okay. Now we come to asbestos. Usually the asbestos is very much common in cases of areas where shipyard workers are exposed, some pipe fitters or plumbers and welders, and some metal workers, okay, and some industry where insulation material is being produced. Asbestos is very much common over there. Now, asbestos comes into varieties. One is the serpentine, and the other one is the amphibole. Now, which one is more pathogenic? The more pathogenic is the amphibole one. Serpentine is pathogenic, but not that much. Okay, what is the reason? The reason is that the serpentine is more flexible and it is curved, as you can see over here. Okay, and it is very much soluble as well. Okay, and because of its structure, it is very much caught early in the respiratory tract. Okay, however, the amphibole is very much stiff. It is long. It is less soluble, and it is delivered deeper into the lungs. And you can see over here the straight type of the structure of the amphibole type of asbestos. Okay, and in simple words, you can see you can use the word aerophilic, which means that which one is more carried away by the air is this variety, that is the amphibole variety. So when it goes deeper into the respiratory tract, you already know that in deeper areas, your respiratory tract protective mechanisms are very much depressed over there as compared to the earlier portions of the respiratory tract. So it is more fibrogenic over there, and it is less soluble, and that is the reason it is more pathogenic. Okay. Then what are the conditions that can be related to asbestos? You can have localized plaques, and you can have some diffuse pulmonary fibrosis. You can have pleural effusions. You can have parenchymal interstitial fibrosis, then lung carcinoma, then mesothelioma. In simple words, you can remember that it causes the disease in the pleura and disease in the lung, fibrosis in the pleura, uh, carcinoma in the pleura, then carcinoma in the lung, and fibrosis in the pleura. You can remember this in short words. But this is an important point that you need to remember, that when there is asbestos related diseases come in discussion, we say that there is formation of lung carcinoma as well as mesothelioma. Which one is more common? Remember that lung carcinoma is far more common than the development of mesothelioma. Okay. And uh, if the person is exposed to asbestos plus he is a smoker, then it is said that the incidence for development of lung carcinoma becomes very much increased as compared to only asbestos exposure. But remember the important thing, that asbestos is going to cause more commonly lung carcinoma, and secondly, it can cause mesothelioma as well, but it is less common as compared to the lung carcinoma. In addition to these, they can also cause other tumors as well, like the laryngeal and ovarian lung carcinomas, then extrapulmonary neoplasms like colon cancers, and some autoimmune diseases and cardiovascular diseases have been proposed to be related to asbestos. Again, the pathogenesis of asbestos, inhalation of asbestos is going to do what? Interaction with the epithelial cells, with macrophages that penetrate into the alveoli. They cause release of mediators. Then ultimately it leads to fibrosis as well. Over here, remember that the asbestos also acts as an initiator and promoter, and ultimately it leads to carcinogenesis. That is the reason that it causes the development of lung carcinoma as well as mesothelioma in these conditions. Okay, asbestos is a disease of lower lobes. So it usually starts at this level in the respiratory bronchioles, and then it travels down into the alveolar ducts and then sacs. And when it is filled, then it moves upwards. So it is from distal to proximal. Okay, the middle and upper lobes are involved later. Okay. Now, asbestos shows diffuse pulmonary fibrosis, and in the early stages, there's minimal fibrosis, and at the end, they can show the dilated cystic areas, which may be composed of honeycomb appearance as well. Okay. This is the pleural plaque formation, and you can see over here, this is the undersurface of the lungs, probably the diaphragm, and you can see over here there are some patches of plaques over here. It looks, some of the books say that it looks like a candle wax, like something when you burn a candle and you put something on the table or on a paper, it just looks like that wax that is present on the pleural surfaces. So these are what we call as the pleural plaques. It is very much common to have these manifestations, and uh, important thing is that they do not contain the asbestos bodies. Okay, and very rare in individuals without history of asbestos. So it is very much related to asbestos exposure. And you can see over here, this is very much well circumscribed. They are composed of collagen, obviously fibrosis, and sometimes they can be calcified as well. On microscopy, you see these are the dumbbell-shaped structures. These are what we call as the asbestos fibers, and these are the asbestos fibers over here. Okay, and they usually have golden brown in color. They are golden brown in color. Why they are golden brown in color? Because of the ferritin or iron that is stored within the macrophages in which they have been engulfed. Okay, in which they have been engulfed. This ferritin release and deposits on the more on the ends as compared to the center. Okay, so this makes them golden brown in color, and sometimes we call them as the ferruginous bodies. Ferruginous bodies is basically a broad term for the inorganic material being engulfed by the macrophages. But if it is diagnosed or confirmed that this is asbestos, then we call this ferruginous body as the asbestos bodies. Okay. So this looks like a dumbbell, and that is the reason that we call it dumbbell shaped. Okay. Now, clinical course of the asbestosis is usually 20 to 30 years after the first exposure. Okay, the earliest signs are going to be the dyspnea and exertion with exertion, and later even at the rest. And usually, cough and sputum production are very unusual. If it is present, it can be attributed to the smoking or the cigarette smoking. Now, this can lead to respiratory failure or cor pulmonale right heart failure and ultimately death. The pleural plaques that I have already shown you, they are asymptomatic and they can be detected on radiographs. Okay. Now, asbestos complicated by lung cancer or pleural cancer can be associated with grim prognosis. So, when asbestosis is due to lung cancer or pleural cancer, causes the lung cancer or pleural cancer, it has a very bad prognosis. And over here in the lower lobes, as I already told you, this is a disease of the lower lobes. You see over here, these are the irregular densities or the that are present in the lower lobes, these reticular densities. So, and ultimately they may lead to the formation of honeycomb formation. Okay, ladies and gentlemen, this was all related to